Guys, huling gamit ko na ng salamin. Ito na ang araw ng aking LASIK surgery. Medyo excited ako na kinakabahan. Balitaan ko kayo mamaya kung anong mangyari sa loob. Samahan niyo ako. Papunta na ako sa BGN Hospital. Samahan niyo ako kung anong mangyari sa loob. Let's go.
Eto na guys, ganto nga palang itsura sa labas ng BGN Eye Hospital sa Busan. Tapos naka-display dito sa wall yung iba't ibang klase ng procedure sa bawat floor. Pagpasok mo pa lang sa first floor, grabe ganda na ng ambience sa labi nila sa unang palapag. Sobrang luwang, first floor pa lang yan ha. Hindi po yan sponsor ha, dahil sobrang mahal ng binayaran ko.
Fourth floor tayo guys. Kinakabahan ako. Excited na kinakabahan. Okay, let's go.
Paglapag mo nga sa fourth floor si ating magandang Koreana ang bubungad sa iyo. Tapos ipapag-fill upin kanyang form. Kakatuwa nga dito, lahat ng sulok nila ay may locker kung saan pwede mong ilagay ang gamit mo. Yang nagpaupo sa akin, siya nga pala nag-assist sa akin, si Ma'am Maria. Simula na ng examination sa mata natin. Ito yung pinakamatagal guys. Inabot ako ng ilang oras dito. Gawa ilang machine yung pinagdaanan test sa mata at iba't ibang examination. I-check lahat dito kung may astigmatism ka, tsaka yung grado ng mata mo. I-check din yung laki ng pupil mo. Tapos kung makapal pa ba ang cornea mo. Dahil may thickness silang pinagbabasihan kung ano ba ang nararapat sa yung surgery sa mata. Dito natapos na nga ang iba't ibang klase ng eye test. Naghihintay na lang sa doktor. Gawa ng sasabihin kung okay ba ang examination.
Everything is okay. Yeah, everything is okay. Fine. Yeah. So, yeah, you can receive smile LASIK. So, are you gonna receive today? LASIK.
Yes.
Smile LASIK today.
So,
다 했어요 그러면은?
아직이요. 상담 중이라서. 네네. So basically there are no abnormalities in your examination. So it's 500 to 550 micron. It's like the usual corneal thickness. In your case, we have quite good corneal thickness. It's not very thick but not very thin. It's 531 for your right eye and 532 for your left eye. So our expected vision is 1.0, 1.0. So in Korean standard, like 1.0, 1.0 means 100%. So the full recovery. Like in US standard 20 per 20, in Korean standard 1.0. So the full recovery for both eyes is possible. So your expected vision after surgery is 20 per 20, like full recovery. But now your glasses are quite weak. It's only 70% for your right eye and 60% for your left eye. Yeah, so it will be, the vision in after surgery will be better than your glasses because your glasses are a bit weak. Okay? Yeah, it's a good thing. And the last thing I will explain before we get to the surgery part. So your pupil size is quite small. You see it's 3.5 millimeters, 3.3. Usual size at the daytime is 4 millimeter to 4.5. But it's good when the pupil is small because you get adjusted to the halos and glares faster, like light sensitivity at night. It depends on the pupil size. The bigger the pupil, the longer we need adjustment period. You have a small pupil size, so maybe just 2 to 3 weeks. Do you drive in Korea?
No, but in Philippines
I see. Just for 2 or 3 weeks after surgery, we don't recommend night driving because you proceed with a smile surgery, day driving tomorrow, fine.
But I can work in Monday.
Yeah, you can work even tomorrow, no problem. Just night driving. Night driving for 2-3 weeks. Better avoid. Day driving, even if you decide to rent a car here, you can drive tomorrow, but daytime. Yeah. Eye dryness. You don't wear contact lenses, so you don't have extreme dryness, but most people today have some dry eye because we work a lot with computer, mobile phone, and so on. So this was an examination for dry eye. It shows if our tearing liquid is within the normal amount. In norm, it has to be 20 to 25. we have a bit smaller, so you have some dry eye. You see like 10 to 15. It's not extreme. Some people will have with a contact lens even smaller, but you need to know you already have some dry eye. Okay. Yeah, and we'll explain how the surgery is done and then the subtype. So as we wish to proceed with the smile surgery, we don't remove the upper layer like LASIK. We don't make a huge flap like LASIK because correction is always done in the inner layer of the cornea. So we use a femto laser called Visumax. It proceeds with correction in the inner corneal stroma without touching the upper. It forms a part of cornea which is called lenticular disc. Just a small whitish tissue. It depends on how much we need to correct. More diopters, thicker it is. After we form it, we need to remove it somehow. So the same femto laser makes a micro incision on the upper layer of the cornea, and through this micro incision, we just remove that part of corneal stroma which was formed in the inner layer. That's all. Surgery finished. That's why our recovery is quite fast, because we only have micro incision. And basically, even after usual Smile, not Smile Pro, you have discomfort only 4 to 5 hours on the day of the surgery. Next day, your vision recovers around 70-80%, so like your glasses even a bit better. So you can get back to work on the next day already. You can wash your face on the next day, but for 1 week only, because we have 1 week for healing.
So I can wash the face in the next day?
Yes, tomorrow is possible, but today water should not get into your eyes. And this micro incision, it heals within 1 week. So only 1 week patients should avoid sweat-inducing workouts, so there is no sweating into your eyes, like gym, or also basketball, football, anything that can hit your eye, like boxing and so on, swimming, and chinchilban sauna. After 1 week, everything is possible. So you can get back to any type of sport. I mean, work is possible from tomorrow as well. You don't have a lot of sweating during your work, right? If you need to, for example, carry some heavy things, no problem. It's not a problem, yes. But the sweating into your eyes for 1 week, sweat should not get, okay? And yeah, I will explain about the subtypes of the surgery. I think you know already. And then just for you to know, I will explain about the Smile Pro as well. Let's get to the smile subtypes. So we have a basic smile surgery. Then the one I think you were telling doctor you wanted to proceed with a triple smile, right?
Yes.
Yeah, so the triple smile is a procedure when we do the basic smile surgery and the cross-linking. Cross-linking is a good procedure to prevent the secondary vision decrease. We use the medication called riboflavin, which is kind of vitamin B2. So we put, this is just LASIK, we don't make a huge flap for a smile. So after we proceed with smile surgery, we put a medication called riboflavin on your cornea for around 15 to 30 seconds. Riboflavin starts getting into inside the corneal cells. And after that, patient will need to look at the blue light. We use a better UV ray machine, so the blue light helps to activate the riboflavin inside your corneal cells. It's not painful. You just look at the blue light, at the bright blue light, for around also 15 to 20 seconds. So that's all. What does it give? If the surgery, after surgery, our corneal cells looked like this, so the connection between them. This is how they look after procedure. So it prevents the secondary vision decrease around twice. Your probability of secondary vision decrease is not huge, it's around maybe 6% or something like that, but if we do the corneal strengthening, it becomes even twice less, so no more than 2-3%. So it's a good procedure to prevent the secondary vision decrease. Yeah, just before we decide, just for you to know, I will briefly, I mean, we definitely can do the triple option you're opting for. I will just explain for you, like, to know the difference between the equipment. The Smile and Smile Pro. So this is the Smile equipment. It's also quite new surgery. We do it from 2013. It's like 11 years. And this is how the Smile Pro looks. We do it from 2023, so last October. It's Visumax 500 or Visumax like 800. What are the main differences between this equipment? The laser time, usual Smile is also very fast. It's only 25 seconds. But the Smile Pro, it's around 7 to 9 seconds, less than, around 2-3 times faster. So basically it gives even faster recovery, even less discomfort after surgery, and less dry eye. That's basically what for this Smile Pro. And the second difference is the robotic assistance system. What does it mean? Two things during Smile are done manually. Those are centration and the axis for astigmatism correction. I will explain. So when the surgery starts, doctor needs to fix the laser on the center of the cornea, on the center of the pupil. It's called centration. So doctor also does it according to your examination results, but there may be a smallest error, like because it's done manually. In case of Smile Pro, it's done by a robotic system. So there is like almost none probability of a wrong location. So it provides a bit more accurate result for IOP or nearsightedness correction. And the second thing, you have a very small astigmatism, but for patients, for example, with a high astigmatism, it's also very important to correct astigmatism very precisely. So when we correct astigmatism, we have a word called axis. To say it easily, it's angle, kind of the angle we need to change during surgery for the equipment. Just in usual Smile, doctor makes it manually. And in Smile Pro, it's done automatically by the robotic assistance system. So it's a bit more preciseness for the astigmatism correction. That's main two things. Okay?
Dito sisimula na ang procedure. Parang ooperahan ako sa katawan nito Bakit ganyan ang suot?
Please, we will put medication. Look up. We put anesthetic and antibiotic eye drops. Look up, please. Look up. Good. Betadine, kind of iodine. Don't open your eyes until we finish. So during surgery, there is no pain because we use anesthetic eye drops more times, but there is some feeling of cold liquid, bright light, and touch sensation. It's normal, and some pressure of the laser. During surgery, please don't move your head or your body. If you want to cough, sneeze, or have any other kind of discomfort, just let us know, but don't move first. So during first part of the surgery, you need to look at the green light, green blinking light. It may disappear last 5 seconds, but you keep looking straight, don't move, don't look for the green light, okay? And during the second part of the surgery, you just need to look straight at the bright light. There is nothing painful, just a small pressure, so you don't need to worry. Open your eye, look up please, look up.
Kakatapos lang ng operation. Ang pakiramdam ko ngayon medyo blurry pa sa aking mata. Medyo blurred pang mga nakikita ko. Pero yung normal lang naman daw gawa ng in time pa ng mga 1 hour bago luminaw. Ito, libre nila. Libre binigay sa akin yung mga gamot, mga eye drops. Ang laki pa rin ng na discount sa akin. Sila ngayon may promo. Nawawala na unti-unti ang anesthesia nilagay sa mata. Nararamdaman ko na sakit na.
Pauwi na ako dyan at sinundo ako ng Kuya Rodel. Kilala niyo naman siguro siya. Naipakilala ko na dati sa ilang video ko. 30 minutes to 1 hour. Pagtapos ng operation, dito ko naramdaman yung sakit sa mata.
Pag kayo magpapalasik, mas maganda may kasama kaya mahihirapan kayo pag pabalik. Pwede naman pag magpapahinga muna kayo ng mga ilang oras doon sa lunch. Buhat na din yan Kuya Rodel, may sumando sa akin. Bye-bye na, sakit na ng mata ko.